Good morning. This is me Nafisa. Today we'll be learning about sinusitis. Let's learn the pronunciation. Sinusitis. Sinusitis is an upper respiratory tract infection. What is the definition of sinusitis? Infection and inflammation of sinuses. What are sinuses? Sinuses are hollow, air-filled cavities. Sinuses are present in the bones of our face. We human beings have 4 pairs of sinuses. Maxillary sinuses present on each side of our nose near our cheekbones. Frontal sinuses present above the eyes near our forehead. Ethmoid sinuses are located on each side of the bridge of our nose in between our eyes. Sphenoid sinuses behind the nose at the sides of the head. Because these sinuses are surrounding the nose, these sinuses are collectively called as the paranasal sinuses. All the sinuses open into the nose through a small opening called as Ostia. Now let's learn the function of sinuses. The first function of sinus is sinuses enhances or improves our voice by acting as resonating chambers. Sinuses function to reduce the weight of the head. That's exactly the reason why our head feels very heavy during sinusitis infection. The third function is sinuses protects the face in the event of facial trauma by working like an airbag. Normally the sinuses are empty, except that each of the sinuses is lined by mucous membrane that secretes a thin layer of mucus. So the fourth function of sinuses is sinuses produces mucus. In healthy individuals, the mucus is a thin, watery and slippery fluid that flows freely from the sinuses into the nose through small openings called as ostia. But when there is an infection leads to inflammation. Infection and inflammation of sinus is called as sinusitis. Because of inflammation, the mucus becomes thick and very sticky like an adhesive. Because the mucus is like adhesive, so mucus will not be able to flow through the tiny openings that lead to the nose. Hence, there is mucus accumulation in the sinuses. This causes pressure and pain. Depending on which sinus is involved, pressure and pain is experienced there. For example, if mucus accumulation is in the maxillary sinus, then pressure and pain is felt near our cheeks. If mucus accumulation is in the frontal sinus, then pressure and pain is felt in the forehead and along the eyebrows. If mucus accumulation is in the ethmoidal sinus, then pressure and pain is felt in between the eyes. If mucus accumulation is in sphenoidal sinus, then pressure and pain is felt at the sides of the head. During sinusitis infection, head feels very heavy. Remember, I mentioned this. So sinus pain usually increases when we bend forward. Mucus accumulation in the sinuses further makes the sinus a great place for the bacteria to live and grow rapidly, as mucus is rich in nutrients. Thank you so much.